Hello, everyone. My name is Dr. David Roberts, and I am Dean for External Education here at HMS. And it is my pleasure to host this week's Voices from the Community. The HMS Office for External Education provides educational content in the form of live and online courses, as well as print and digital media resources on health and healthcare to a broad population of learners around the world. Now, during these challenging times, we have maintained and even grown our programs and enabled greater impact from our faculty, reaching literally millions of people around the globe. The Office for External Education includes over 100 educators, technologists, program managers, and many others, all dedicated to bringing the best of HMS and our faculty to the world. Today, I'm very excited to be joined by four members of our team: Urmila Parlikar, Ameris Davis, Tami Bolk, and Kevin Tucker. I am going to ask each of you to introduce yourselves and your roles.
Hi, I'm Urmila Parlikar, Associate Director of Digital Health Products at Harvard Health Publishing.
Hi, I'm Tami Bolk, and I'm a Program Operations Manager in Postgraduate Medical Education, or PGME for short.
Hi, I'm Ameris Davis, Program Operations Coordinator for PGME.
Hi, I'm Kevin Tucker, Faculty Director for Accreditation and MOC, also in the Department of Postgraduate Medical Education.
Fantastic. Thank you all. I'm very excited to have you all here. Urmila, let's start with you. Harvard Health Publishing has been providing trusted information to the general public now for over 40 years in the form of newsletters, special health reports, and content via our website, which is at health.harvard.edu. And we have content now through Twitter and a growing series of e-learning courses. Can you tell us about the Coronavirus Resource Center? Where did this idea come from? How did you get it started? And what has been the impact?
Sure, I'd be happy to. So the Coronavirus Resource Center is Harvard Health Publishing's go-to resource on coronavirus. We've answered more than 100 questions about coronavirus and COVID-19 on the site with input from HMS faculty members. We also link to blog posts and podcasts written by or featuring Harvard faculty. We launched the Coronavirus Resource Center on February 28th. We'd been monitoring reports of the virus since the beginning of the year, and the first US case was announced in late January. At the time we launched, there were fewer than 100 confirmed cases in the US. The initial idea for the Resource Center was simply to provide some background information. We answered questions like, what is a virus and how does your immune system fight viruses? And then things began to move very quickly. We ran a blog post about coronavirus and it immediately became our most popular post. The WHO declared COVID-19 a pandemic and parts of the US were going into lockdown. There was still so much unknown about the virus and there was a lot of conflicting information out there. People had lots of questions and were looking for trustworthy information. We decided to expand the scope of the Resource Center and to do it quickly. We created new sections on spread, prevention, testing, who was at increased risk, and what to do if you were sick. We also addressed coping because the pandemic was starting to take a toll on people's mental health. I've been working closely with Dr. Howard Lewine, HHP's Chief Medical Editor. I also reached out to other Harvard medical and public health experts. Despite how busy our doctors were back in March and April, they were very generous with their time and expertise. With their help, we were able to get important information out to the public. In mid-March, the Resource Center was getting about 750,000 page views per day. Around that time, we also added a submit a question button to the site. It really helped us understand what was going on in people's minds. For example, I remember getting lots of questions about going to the grocery store or the gym and whether it was safe to order takeout. Our Resource Center has continued to grow. Our faculty bloggers have written about many aspects of the pandemic, and we link to their posts from the Resource Center. We're also continually updating the site with new information and answering new questions on the site. More recently, for example, we've seen a lot of interest in the status of treatments and vaccines and questions about long haulers and post-viral syndrome. We'll continue to update our site with the latest developments. We've had nearly 30 million page views since February, and I hope people will continue to turn to our Resource Center as we head into winter.
Fantastic. Thank you, Urmila. It's been an amazing work and a great resource. Now, our postgraduate medical education group has faced a different set of challenges related to the COVID-19 pandemic. We had to completely transform our model of offering live educational programs here on campus and in a number of sites worldwide. And we had to shift to a live virtual approach. Ameris, what has it been like to completely change your workflow and to operate remotely? How did you navigate the challenges of quickly pivoting the programs and all their operations to an online format?
Thank you, David. I definitely had to make a few adjustments to my workflow in order to deliver and maintain the same quality of work remotely as I did while working in person. So like so many others, when we started pushing program dates back, I thought this would go away fairly quickly and we would be able to jump back into the normal swing of things in a couple of months. However, once the decision was made to actually change our model of in-person delivery to remote, we all quickly realized that that wasn't going to happen soon. So one major adjustment I had to make was widening the form of communicating. So not just communicating via email, but utilizing and becoming more comfortable with new virtual platforms such as Microsoft Teams and Zoom. And so navigating the challenges of virtual communication, both individually and as a team, was something we all had to do in order to successfully pivot to an online format. So everyone quickly realized that we needed to take a holistic view of the virtual program needs and work together to find out what was possible and compare it to what was needed. So we gathered as much information as we could on all of the various virtual tools available. We compared the pros and the cons and got extensive feedback from different team members. And then ultimately we determined that Zoom was the best platform for delivering the same high level of programming that we would in person.
Fantastic. Now, Tami, what has this transition been like for your team, for the PGME, the Postgraduate Medical Education staff? How have you maintained a sense of community? You're a very tight-knit group and helped one another.
Yeah, so one thing that I can firmly say about our staff is that we are a resilient bunch, and we were ready to embrace the change because, for one, we knew that we had to in order to continue that our programs, to ensure that our programs continued, but also a part of it, at least I can say on my end, came from the excitement of doing something new and different. From an operations perspective, there were so many different parts of Zoom that we were all quickly navigating, and it felt like we were learning 10 new things every day about its capabilities and limitations, and which was great, but we needed to centralize that information so everybody had the same baseline. So Ameris and I put together a Zoom handbook that we initially circulated just amongst our internal PGME team. And then we realized it would be beneficial to share it across the entire department as other teams transition their programs to Zoom. So as a follow-up to that, we also led a couple all-staff training sessions so that folks could really dive in and take the lead as host or co-host to feel more confident managing their own virtual programs. As Ameris mentioned, we quickly realized how crucial the communication aspect was when transitioning our programs online. So for our colleagues on our education team who work primarily with the faculty and the students, it was important to know not only how the Zoom features were used, but also how they could be best utilized within a program and what were any of their limitations. So we started having more team check-ins across the teams to test new features and ensure we're all on the same page and able to deliver consistent quality across all of our programs. And this has really helped us all maintain a strong sense of community and awareness that we are all in this together.
Thank you, Tami. Both you and Ameris and the entire PGMA team are to be congratulated for really some fantastic work. So thank you again for sharing that. Now, our external education team has also been working to highlight and combat systemic racism and enable more diversity and equity in healthcare. Kevin, can you tell us about your work leading the development of our fantastic health disparities webinar series, and what has been the impact over the last few months?
Sure. Thank you, David. In February, we decided to develop a webinar series to provide education on COVID-19. And the webinar series reached a large number of learners. Later in the spring, we had a convergence of two separate events. First, the murder of George Floyd, and then the apparent disparities in outcomes of COVID-19 in communities of color. And so we thought it was important to address this convergence of events by developing a webinar series that were focused on the impact of race and racism on healthcare disparities. Now, while I have been acutely aware of disparities in outcomes in kidney disease as a nephrologist, I am not an expert in healthcare disparities. So we looked within the Harvard community and partnered with Dr. Cheryl Clark from Brigham and Women's Hospital, who is an expert in healthcare disparities. And we developed this webinar series utilizing resources from within the Harvard system, but also from outside of Harvard. And we've had leading spokespeople who are social justice activists. We've had academicians. We've had community workers who've all shed important light on the role that structural racism plays in perpetuating these healthcare disparities. And it's been amazing the number of learners that we've reached around the world. I think we've reached some 50,000 learners. And the feedback that we've received on social media has been really tremendously exciting and positive. So we're looking forward to continuing this webinar series and hope to continue to highlight the underlying structural issues with respect to racism that perpetuate healthcare disparities.
Thank you, Kevin, and thank you for all your leadership on this series. It's been incredible to extend the reach of Harvard Medical School in such an important area. So as we close this week's Voices from the Community, we really invite you to learn more about the HMS Office for External Education, our programs, and our resources. Faculty who are interested in working with us, please contact us directly. And learners interested in our program are encouraged to visit our website, where you'll find video, trailers, and free health information and resources. So thank you again for joining us this week, and thank you to all our colleagues across external education who have done so much impactful work during this very challenging time.